Okay, so this is my patient Xander. He is a 10-month old, and this is his mother Lolly. Um, let's see. So let's start with some general questions. I know we were talking about weight and height. Do you remember how much he weighs last time you weighed him?
22 pounds.
Okay. And do you know how long he is or what his height is?
20.
Okay, so baby's actually feeding right now, which means it's a good opportunity for me to listen because he's calm. So I'm going to start listening to his backside for his lungs. Okay, lung sounds are clear bilaterally. I'm just going to try to listen to his heart for a little bit. Okay, maybe because since I didn't get quite too early.
What's that? What's that? What's that? What's that? It's okay, it's okay. What is that?
Okay. Yeah. Just quick listen to. Okay. So S1 and S2 are heard. No murmurs are found. And lung size on the interior side sounds good. Okay. So I'm going to take a look at it, inside his ear just to see if there's any redness or anything wrong with his tympanic membrane. Okay. Can you look at mom?
Okay, I just hold it. I just hold it. I just hold it. Okay, no, it's okay. Auntie just looking at your ear.
It's okay, dude.
Okay. See?
Okay. Tympanic membrane is clear. No redness. No bulging. Okay. Can I just take a quick look on the other side?
On the other side. Let's look at the other side. You're gonna look at your ear. Look at the video.
What's a video?
Look at the video. Who's that?
Tympanic membrane
Who's that?
is clear. No redness, no bulging. Okay. And then let me just take a quick look up his nose. He's gonna look at the light.
Ooh,
Have you noticed anything with his breathing, like any respiratory distress or like troubles with like blockage of the nair or anything?
No.
No? Okay.
I mean, he got over a cold.
Oh, okay. So it was a little stuffy,
Yes.
but then it's clear now. I don't really hear any stuffiness anymore. Okay. Can you open your mouth? Oh, you're so good. You're a good boy. Good job. Oh, I do see some teeth coming in.
Mm-hmm.
Do you know how many he has?
I believe the fifth one is coming in.
Oh, fifth one? Okay. Have you noticed any changes with, like, because he's teething, like an irritability or lack of sleep?
Yes.
Okay. So resuming with the head assessment, I didn't feel any bumps or and mom reports no bruising or masses or anything like that. Okay, I'm just going to feel around a little bit around his neck. Feel a little bit around his. Have you ever noticed any like difference in movement? Like one side has more mobility than the other, and like raising his arms and stuff, or when you're carrying him?
No.
No. Okay. Let me just go ahead and I'm just gonna feel for his pulses really quick.
Okay.
Okay. Okay. Okay. Hold my hand. Hey. Okay. Oh, you want to play with this? I know you like this one, huh? What's that? Mm-hmm. So pulses are there's a steady rate and rhythm, and I don't feel any bounding, and it feels like I would rate it out of 2, which is normal. So let's see. Skin turgor is good. He seems like. Have you ever noticed? Oh, have you noticed any like dryness or any?
He had a bit of an eczema issue, but I feel like we
was it on the backside?
Yeah, we were able to control it.
Okay, using just lotions and things like that. Okay, yeah, it doesn't look too bad.
Feels a lot better.
I noticed, like, yeah, he has like some redness and stuff like that. Is that normal for him?
Yes.
Okay. Yeah. Okay. Okay. So let's see. I'm actually gonna have you, if you can, maybe like lay him down with his head closer to you, so you can kind of hold it and play with his arms, if he'll let us. That way, I can lie down.
Let's lie down.
Let's lie down.
Let's lie down. Okay.
Good job. Okay. So. Okay.
What's that?
Okay. Vowel sounds are clear. Abdomen is soft and non-tender. Okay. And then I'm just going to check like his mobility. Oh. Obviously, he's reached some milestones. He's able to flip over. Okay. You can play this way. Then I'll just do some other stuff. Cap refill is good. Okay. Let's see here.
You still want to lie down?
If
Oh no! Look at this one. Look at this one. What's this? What's this? What's this?
You're okay.
Look at this. What's this? What's this? What's this? Look, baby. What's that? Here.
Okay. Well, he's like, I can tell he's okay. So no abnormalities in like his hip movement. Okay. So for this next test, I'm gonna check for the red reflex. Okay. So just have him sit, and then he can take a look. But I do shine a light in his eyes. Okay. So checking. Red reflex is present in both eyes. Hi. Okay. So there's that, and then I'm also going to check for pupil dilation. Okay. Good. Okay, and then he's also obviously already tracking, so I'm not really too concerned about it. Have you ever noticed any like drooping of the eye or any like lag or like where his one eye goes one way and the other goes the other? Okay. So we are gonna just review some of the milestones, the developmental milestones that he should be at. So he is 10 months now, which is right in between. So I'll go based off of 9 months, which is what he should be doing. Okay.
Yes.
Obviously he's sitting steadily without support. And is he able to pull himself up?
Yes. And
he can crawl, already starting to walk, right?
Yes.
Okay. We already established that he's able to start cruising and stuff like that. Okay. Let's see. So have you noticed his ability to like grab things off the floor? Has he been able to use like pincher? Yeah. Okay, good. And is he able to feed himself with like the little cereals? Okay. He can drink from a cup. His cup, like a sippy cup.
Yeah.
Okay. Have you tried to give him like a crayon at all or anything like that? yet? No? Okay, but you've noticed he can hold and pick up things by
Yes.
himself. Okay. Have you played like hide and seek with him where
Like peekaboo.
yeah, kind of like peekaboo, and does he actually like look for the object where you hide it?
Yes.
Okay.
He knows exactly where it is.
Okay. And then also if like something is dropped, like he'll kind of look.
Yes.
I think I noticed him doing that too. Yes. Does he respond to simple verbal commands, like kind of like if you say no, or
Yes.
he'll like respond to his own name and
Yes.
stuff like that? And I think you mentioned earlier that he does say dada. Okay. Let's see. Does he? Let's see. And we already established that he started pointing and gesturing
Yes.
at things. Can he say, like, has he started to wave at all, like that, but for like saying bye or play
No, he
patty
hasn't
cake?
actually done the waving.
Not
thing.
the waving yet. Okay, that's fine. But he can. I think I saw him. Also, he's like been able to clap his hands
Yes.
before. Okay, so kind of like playing patty cake. Okay, so that's pretty good. And then at 12 months, let's see. I guess things that you can start to look forward to or look for when he's 12 months is he'll be able to like stand more. What's the word? Steady. He'll be able to throw a ball maybe overhand or like use kind of like a spoon, the action of the spoon, or turn a page. Let's see. Egocentric thinking. So all those one-step commands. Let's see. Let's move on. So he'll also start obviously to talk a little bit more. So he says dada, but he doesn't quite say mama yet, right?
No, he says
Okay.
Nana.
Okay, Nana. So that's grandma. Okay, so hopefully he'll start to actually identify, like, associate those words with the people and stuff like that. And then he's very autonomous, meaning like he's independent already. So I guess he's already reached that milestone. Hi, bub. And then let's see. Have you noticed any like temper tantrums or anything?
Yes.
Okay. Well, just fair warning. At 12 months, you'll probably start to see it a little bit more often. So that's just something that's normal. And at the next visit, we'll maybe talk about some like management techniques on how to handle the temper tantrums. Okay. All right. Thank you. Okay, so at this point, I believe that I've conducted most of my exam, and I'm just going to go over the list to make sure that I didn't miss any points, okay? Just a moment ago, he was crying because he was hungry, so he does have a strong voice. And have you ever noticed any like, or has he been communicating with you and stuff like
Yes.
that? Like, obviously, he's very vocal.
What do you need? What do you need?
Okay. So we did listen to the heart, and yes, again, S1, S2 was heard, no murmurs. The lung sounds were bilaterally clear, both sides, anterior and posterior. There's no signs of respiratory distress. Mom also denies respiratory distress. And let's see, yeah, I think his chest rise is equal. His hair distribution is even. There's no bruising, swelling, or asymmetry noted on the scalp. His face is symmetrical. Are you tired, bud? Yes. And let's see. Fontanelles, let me just check. Yes, I know. I think they're both closed. Anterior and posterior fontanelles are closed. Color of the mouth was pink. It was moist. He does have some emerging teeth. Mom reports 5. No cleft lip or palate. And tonsils were intact. Let's see. No. Upon lymph node inspection, they were soft and non-tender. And the eyes, sclera is clear. No redness. No discharge. Have you ever noticed any discharge in his eye? Okay. Yes, alignment of eyes are even. No, mom denies any strabismus or nystagmus, and he's able to follow my pen light or track my pen light well. Pupils are equal and reactive to light. red reflexes present. No ear tags or pitting. Ears are symmetrical. Tympanic membrane was clear, no redness, no bulging. Nares are clear. Mom reports or denies any respiratory distress or blockage. Well, you said when he was sick, it was a little bit stuffy nose, but that's to be expected, and it's now cleared. Nasal bridge is intact. Abdomen was soft and non-tender. No hernias noted. No hernias when he was born or anything like that. Okay. Mom has denied the genitalia exam, so we'll skip that one. Do you have any concerns or anything like that with rashes or anything like that?
He has sometimes
Sometimes, okay.
a diaper rash, but
And then are you treating it with, okay, so
zinc
lead cream?
oxide, yeah.
Okay. Good, right there. Let's see. Any rashes or we talked about a little bit eczema, but that's cleared up now. With, you treated it with lotion.
yes.
Okay. That's okay. Any disorders with, like, anything noticed with the nails
No.
or anything like that? Okay, you can play with that. Musculoskeletal, so his hands and feet. Come here, bud. Okay, you can play with that.
You like this one? This one's better.
Let's have it on you. Okay. So yeah, hands and feet. His strength and tone are good. Yeah, exceptional. Mom says. He is already starting to walk, right? Like, kind of, he has a walker at home, and he does cruise, what they call it.
Yes.
Okay. And clavicle is intact, no crepitus felt. Ortolani and Barlow test was conducted, no dysplasia of the hips at this time. Let's see, last thing is spine. Spine is straight, no truncal curvatures. Yes. And then, hi. Yes. Okay. So, yes, I believe that we conducted the head-to-toe exam. Now I'm just going to move on to the anticipatory guidelines. So I just have a couple points that I wanted to address with you today. This is more for you, Mom. So my first question is, do you have a regular time for yourself?
Yes.
Yes? Okay. What do you usually like to do for you time?
Go to the gym.
Oh, I know. Okay.
Go to the gym.
Mm-hmm. Do you still get to go out with friends and see family? Family comes to visit?
Family comes to visit as much as they can. We try to do play dates with my friends who have babies.
Mm-hmm.
The majority of my friends have kids, so.
Mm-hmm. And everyone
That's
gets
nice.
along, yeah.
Yes.
That's nice. That's good. Okay. And what changes have you noticed in your baby's sleeping habits? Or have you noticed any changes? Sorry.
Not necessarily. It's just he doesn't sleep through the night.
Okay. So how often does he get up?
Maybe 2 times.
Okay. And what do you usually do those 2 times?
I nurse him to sleep.
Okay. And he usually falls back asleep with
Yes.
that? Have you ever tried just patting him to sleep, or?
Me personally, no, but my husband has.
Okay. And does it usually work for him?
Sometimes.
Sometimes?
If I'm
Okay.
not there, I think yes.
Okay. So maybe, because I know that studies show, like, at maybe his age, since he is old enough, that it's not necessarily because he's hungry, but maybe just wants more comfort.
Yes.
So you could try establishing more like a bedtime routine and just comforting him into bed. I know they were, studies showed that like an hour leading up to bedtime to kind of, slow down, and then putting him to sleep when he's tired but not fully asleep yet.
Mm-hmm.
So that sometimes helps too.
Yes.
Hey, come back here. Okay, let's see. And is he sleeping in his own bed?
No, he is not.
Okay. So, where does he usually sleep?
In our bed.
Oh, okay. And how is it structured? Like, does he have?
In the middle.
In the middle? Okay.
Yes.
Okay, so I'm sure you've heard probably the benefits of babies sleeping in their own bed.
Yes.
Okay. And so maybe. Okay. So yes, the benefits of him sleeping in his own bed, you can maybe try to start establishing like his own separate bed, and you guys, it's better for the parents, better for him. Do you have any concerns about his developmental behavior or anything? Have you noticed any separation or like separation anxiety?
He has separation anxiety.
Okay.
From me.
Oh, okay. And you're a stay-at-home mom, is that right?
Yes.
Okay. So, what do you usually do to like calm him down? Do you kind of give him that attention?
When I walk away?
Yes, when you walk away.
I leave him for a little bit because it's necessary that I'm able to, and accomplish things. But as soon as I come back and pick him up, he stops.
Yes. Okay. So that's actually normal, and it's kind of expected for his age now. It will in time pass. So be reassured that it's very normal. Okay. And then have you been baby-proofing the house and stuff like that? Okay. Starting to, because he's mobile now, so that's probably something that should be done pretty soon.
Yes.
Okay. And then that will allow him to do safe exploration of the house and stuff like that. Let's see. And how, like, has he been starting to communicate? I can hear he's obviously very vocal.
Yes.
Have you noticed any cues that he does? Like you've picked up on his cues?
He points with his finger. What else does he do?
I noticed like he does do that kind of like grunting like that we just heard, where it's like, I don't know if that's something that suggests that he wants something. When he wants something, he'll kind of make a noise, right?
Yes.
Okay. That's good. And let's see. So at this time, you can to enhance that, you can start doing like maybe playing interactive games with him, like hide and seek or things like that. Interactive songs and things like that. Here, go back now. And then, okay, so last question is, does your baby have any exposure to screen time?
No.
No? Okay. Yeah, that's actually advised. It's not recommended for kids his age, because despite all the children interacting games and stuff like that, they're not actually proven to really benefit their development. So we encourage more like reading, talking, or singing, and letting him explore by himself without this distraction of screen time. Okay. Do you have any questions or major concerns about my assessment or anything with him?
No.
No? Okay. All right. Well, that concludes then our my head-to-toe assessment of Xander. Here's one last look at him. Say bye.